Hello, welcome to our live chat today, Lunch and Learn. And today we're going to learn about payer policies and things that are there to help guide you as to what will or will not be covered. This is again going to help you both as professional medical coding specialists, but also as patients, because for the most part, it's your body, it's your health insurance, and it's your wallet that's going to get involved in this. So you got to watch out for yourself, you know? All right, so let's talk about national coverage determinations, also known as NCD, all right? These are policies that cover the entire United States, all beneficiaries in all states. This is covered or this is not covered. Now, if it's covered in all 50 states, okay? Now, Medicare and Medicaid publish their national coverage determinations, but each individual may, at least the major health insurance companies like Aetna, United, Humana, Prudential, all of them also publish national coverage determinations. You just have to know to look for it on their website. Now, as I said, national coverage determination, if something is covered nationally, then that's all 50 states. But it may not be covered nationally. Does that mean it's never covered? No. Then you have to look for local coverage determinations, LCDs, which are decisions made by fiscal intermediaries. That's the carrier, the individual carrier in that particular region or state. Okay? So in other words, something may be covered in South Carolina, but not in North Carolina or Kentucky, or it may be covered in Arizona, but not in Florida. Therefore, wherever you are, wherever your patients are, and this has to do with not where the patient lives, but where the procedure is being performed. Because remember, the providers are submitting the claims. So the place of service is going to be the determination of the location. And again, sometimes something is covered in one state or region, but not in other states or regions. And again, not only do Medicare and Medicaid publish these determinations online, but so do the private payers. So it's a good thing for you to do to check at least once a year, because usually these are annual events, okay? So check at least once a year. And if you are working or coding for a specialty, that makes it easier. The national and local coverage determinations, the NCDs and LCDs, specify the medical necessity for the procedure as well as the specific procedure. And guess what? 99 out of 100 times they were including the exact same, the exact codes, okay? So you will find the ICD-10-CM codes and the CPT codes and the ICD-10 PCS codes that are included or excluded for these particular areas, okay, or procedures. So here is the website for the Medicare coverage database. And you can go there, and you can also, you know, choose it, go to medicare.gov and choose, or cms.gov, and choose it off of the menu. But the important thing is this gives you a search bar where you can look for national coverage determinations, local coverage determinations, and be specific, whether it's a diagnosis or a procedure code that you have. You can look this up very quickly. All right. And if it is something that is directly applicable to you and the facility at which you're working, I recommend save it, print it out. So that way you have evidence in case anybody comes back and says, oh no, all right? And so this is very important. This gives you evidence to support the claim, okay? It also makes things a lot easier for coders and reimbursement because you already know up front what is going to be covered. Remember that submitting a claim for something that you already know is not covered is fraud. So this gives you the way to cover both of it. And remember the False Claims Act, you know or should know. That's the problem with education, because when you're educated, you both should know and know. Okay. All right. So we've also, as we move forward, we're in week 6 now, and 2 more weeks until the end of our course. And you should be filling out your application for your national certification exam because it takes time to process. The butterflies in your stomach are starting. Yeah, okay. Yeah, I know, I do too. Oh, everybody has stress, anxiety. But here are some tips that are going to help you while you are sitting for the exam, as well as everyday coding accuracy. You know, once you get out there and you're working for a living doing this, remember you have a great responsibility, and people depend on you. That's the thing about working in healthcare. All right, so first is have a scrap of paper, like a little pad, okay, you kind of need a writing implement to go with that. I know you might not be used to that because you're everything on the computer, but especially while you're taking an exam, you may not be allowed to have any smartphones or computers with you. So you're going to have to go the old-fashioned way. Okay. All right. Use scrap paper as you're reading through a case study. Use scrap paper to jot down key points. Now, when you're doing this the old-fashioned way on paper, you know, we would highlight or underline something that is prominent that we need to pay attention to, such as a diagnosis, signs, symptoms, whatever. But when you are taking an exam on the computer, and as you move forward into this career, electronic health records are the thing now, have been for over a decade, so get used to it. Okay. All right, so as you're doing that, you can't do that on the screen. You can't underline something, you can't. So have scrap paper and a pen or pencil to jot things down, okay? As you're reading, remember in your head, diagnosis codes explain why the patient required care. So we know that when you have a confirmed diagnosis, that's the diagnosis. If you do not have a confirmed diagnosis and they're going for tests, then you know you're looking for signs and symptoms. And then what was done to or for the patient, procedures, services, treatments. So that may include an evaluation and management code. That may include going right to the procedure if it's an op note, operative report. Okay, but just remember those 2 key words. why, and what. Every single case must have at least one diagnosis code and at least one procedure code. Every case. You cannot have anything without one or the other, because the patient has no reason to be there. Nobody's going to pay for whatever procedure or service was provided. And if the patient has a reason to be there, you're going to tell me you're going to send in a claim when the doctor or the healthcare staff did nothing? Not even talk to the patient? Really? No. So at least one diagnosis code, at least one procedure code. Okay. Read the questions about the case first so you can focus on specifically what you need to look for. So in other words, sometimes a question may ask you just for the diagnosis codes. Sometimes it will ask you just for the procedure codes. Sometimes it will ask you for both. Sometimes it will ask you about an ancillary service that might need HCPCS level 2. I don't know, but no, neither do you. Oh, and that just reminds me to remind you to never assume, never substitute your knowledge or your ideas. If it's not documented, it didn't happen. If it didn't happen, you can't code it. Even if you saw it with your very own eyes, you can't code it unless it's documented. Okay. And the last tip I want to remind you, and this is kosher to go in the national certifications with tabs. So let me drop my book on the floor. Okay. But oh, you see the tabs? Those are permitted to be taken into the testing. Okay. You're not allowed to have papers inside your code book, but you are allowed to have these tabs. And they sell these little Post-it tabs everywhere. They sell them in Walmart and Target and of course Staples, and I may have even seen them in Publix or the grocery store. So it makes it easier for you to get to that point. It saves you time from flipping through thousands of pages. So remember that you always want to be time efficient. Now, accuracy is always more important than time, but time is still a factor, okay? Unless you are coding extremely complex cases, your employer is not going to be happy if you're only coding 1 or 2 cases a day. Now, this is also one reason for the timing of the exams. You must be conscious of the time, but accuracy is still job number 1, okay? All right. Any questions? What do? You email me and you ask me and I will respond. That's how it works. Okay. I'm here 7 days a week. All right. You're going to read chapter 9, regulatory and payer requirements. Again, this chapter may not fully align with medical coding and what you need to know. So make sure you also read chapter 39 in your Let's Code It book. Okay. All right. You're using the 2022 Medical Coding Training CIC Certified Inpatient Coder Study Guide. And chapter 9, really don't use Let's Code It. Don't use the CIC Study Guide. Do this like you were actually taking the exam. Okay, you might want to frisk yourself to make sure you don't have any cheat sheets on you, just to get in the mood. Come on. And then do the analysis, really dig deep, Find out what was that sentence or that word in the case study or the question that threw you off, that you got the answer wrong. This is what we need to investigate so we can correct it, both for taking the certification exam and for real life. Okay. All right. Additional weekly stuff is I gave you connection with the Medicare coverage database and some information on the Veterans Administration health benefits, because you may be coding for them as well. They have great job offers, by the way. They are always looking for medical coders. Okay, email me if you have any questions, concerns. You know how sometimes you're just not sure. You can't put the pieces together in your head. That's a perfect time to email me and just tell me that. And we can go back and forth. We can talk on the phone. We can Zoom. We can FaceTime. We can WhatsApp. Okay, whatever. I'm here to support you. That's all there is to it. So have a wonderful day and keep moving forward.